Today I will be talking about the fungus, which is very common throughout the natural world. It lives in the soil, the water and in the plants and in the air. There are certain helpful fungus and there are harmful fungus. When the harmful fungus invades the body, which usually occurs either when the person's body, the immune system is weak, otherwise due to certain cancer, due to diabetes, due to stress or due to any hormonal abnormalities. Fungus can affect any part of the body. It can affect your face, it can affect your body, it can affect your groins, it can involve your buttocks, it can involve your hands and it can involve your legs. Depending upon the area of involvement, they are categorized as Tinea facie, Tinea unguum, Tinea cruris, and different areas they are named as different names, but it is basically the fungus. Fungal infection, which usually involves the groin, the buttock area, all this is called the jock's itch. And the corporus means it involves the whole body. It can involve your skin, it can involve your hair, it can involve your nails. So there are certain do's and don'ts to prevent the fungal infection. The do's means you can actually keep your hands clean, you have proper hygiene, have your regular bath, and you can even use certain antifungal powders. The don'ts which I would like to tell is certain things like avoid wearing very tight clothes. The boys have the tendency to wear tight jeans, especially when a very humid climate. It is always better, especially in the summer, to avoid these kind of tight jeans. And people have this tendency to use the swimming pools. Try to avoid using lots of swimming pool and any of these overcrowded kind of areas. Now you have to apply the prescription as suggested by a dermatologist, because many have this tendency to meet the doctors and apply these topical corticosteroids which tend to aggravate the tinea. So what I would like to tell you is consult a proper doctor, because these days fungal infections have become highly resistant. So we need to apply powders, topical ointments, creams or gels, and even we need to maintain this proper hygiene, which includes wearing of cotton clothes, avoid wearing all these moist kind of clothes, and apply the creams and ointments in such a way that it is each tinea infection has got a specific period until which they are supposed to be used. What happens is people have a tendency to start using ointments and they tend to stop in between, because we have to see to it that this practice is not being done, because there is something which is known as drug resistance. These days, especially in a crowded area, one person is affected, the whole family members are affected. Sometimes what happens, a single member is treated but the other members are not treated. So if the patient comes to you, you have to tell the patient not only you require treatment, your brothers, your sisters, your relative, your parents, if they are all infected, it is better treat them all together. What happens is you treat the patient and the patient is happy. After 10 or 15 days, the patient comes back telling you that there is the recurrence of tinea. What are the causes? One thing is the lack of hygiene, and he would have mixed his clothes with all his friends, relatives, and they all would also be having this kind of fungal infection, and they would have not shown a proper doctor and they would not be on proper medication. These are all the things which we should think whenever the patient comes to you with a recurrence. Either you should see whether he is using a proper ointment, whether he is taking sufficient amount of tablets. All these things are of real concern. One thing we should tell always the patient is they should wash their hands properly. They should wash their gym clothes properly. They should keep their skin, the nail, the scalp, etc. clean and dry. The other thing is they should use their medicine properly. They should keep their feet clean, cool and dry. And they should use proper footwear, and you should see that the shoes are proper and they are fitting in properly. They should not be very tight. And you should ask them to use the antifungal properly, especially over the affected area as prescribed by the doctor. and you should ask them to avoid walking barefoot, especially in bathrooms, the locker rooms, the gyms, etc. And especially the toenails, all that should be cut straight, and you should avoid ingrown toenails. And family members and personal contacts should be treated with for the fungal infection in case they are having the fungal infection, and you should usually apply the antifungal powder to the shoes every day, and you should discard all the old shoes, boots, etc. One thing I would like to highlight is your personal hygiene is a must, and you should see that you consult a proper dermatologist and take the ointments, creams, gels and tablets as directed by the doctor, and you should see to it that all the instructions are followed. And the other thing which you should see is all your family members are not affected by the fungus and that they are also treated properly. I think I would have made myself clear about the common fungal infections, that it can affect all over your body. One thing is you have to maintain your personal hygiene and see a proper dermatologist and see to it that the drugs are taken properly and to the appropriate duration, and you don't infect others, and that you don't have recurrence if you do the things as advised by a dermatologist. I think I have made myself clear. Thank you very much.